Thank you for your interest in participating in this research study. My name is Laura Lewis, and I'm the lead investigator for this study. This research study is titled Learning from Actually Autistic Health Narratives, Share Your Personal Health Story. In this video, I'm going to review the research information sheet to help you decide whether or not you'd like to participate in this study. All of the information that I review in this video is also available in text format on our study website. As I mentioned, my name is Dr. Laura Lewis, and I'm the lead investigator. Dr. Melissa Hauser is the co-investigator leading this research study. This study is taking place at the University of Vermont and All Brains Belong, Vermont. This study is sponsored by the Autism Intervention Research Network on Physical Health, Scholars, and Pilot and Feasibility. We'll start with an introduction of the study. You are being invited to take part in this research study because you are 18 years or older, you identify as autistic, either formally or self-identified, you live in the United States, and you experience at least 3 different medical symptoms or health conditions, which may be diagnosed or undiagnosed by a health provider. At least one of those medical symptoms or health conditions affects your physical health. This study is being conducted by the Neurodiversity Research Partnership, which is a team of autistic and non-autistic people. The lead researchers for this study are myself, Dr. Laura Lewis at the University of Vermont, and Dr. Melissa Hauser at All Brains Belong, Vermont. I am a nurse and researcher, and Dr. Hauser is an autistic primary care physician at All Brains Belong, Vermont. A team of autistic community members are also serving as co-researchers on this study to guide the research process. Your participation in this research study is optional. We encourage you to ask questions and to discuss the study with anyone you think can help you make this decision. Why is this research study being conducted? The purpose of this study is to learn more about your health journey. We want to better understand what it is like to have multiple health concerns as an autistic person. This information may help us better understand what healthcare professionals can say and do to help autistic adults who face multiple health concerns. What is involved in the study? You can answer questions in the way that you're most comfortable. We can support you with augmentative and alternative communication, or AAC. You can answer questions in person, available in Vermont only, on the phone, virtually, on an online survey, or on a mail-in survey. This study will include 3 stages. In the first stage, tell us how you want to communicate with us. In the second stage, fill in a questionnaire about your health. In the third stage, tell us the story of your health journey. You can find a copy of all of the questions we'll ask you on the study website. In stage 1, you'll tell us how you want to communicate with us. We will ask you about your communication preferences and how you would like to participate in this study, including any supports or accommodations that would help make it more comfortable for you to participate. We anticipate this will take approximately 5 minutes, but you can take as long as you'd like. In stage 2, you'll fill in a questionnaire about your health. We will ask you to answer some questions about yourself, such as your age and gender, and information about your autism identity, such as whether you are self-identified or formally identified and your age of identifying you are autistic. You will also be asked to answer questions about your health, for example, any medical diagnoses that you have had or any symptoms that you experience that have not been diagnosed. We anticipate this stage will take approximately 30 minutes, but you can take as long as you'd like. In stage 3, you'll tell us the story of your health journey. We'll ask you to tell us the story of your health journey as an autistic patient. For example, we might ask, in your health questionnaire, you shared with us that you have faced multiple health concerns. We want to know more about what that's been like for you. Can you please tell us the story of your health journey? You can start and end this story wherever it makes the most sense for you. We may ask additional questions during the interview based on the answers that you give to make sure that we're fully understanding your story. For example, we may ask follow-up questions about your story, like, you mentioned that your health condition affected your mental health. Can you tell us more about that? If you're participating in an interview in person, on the phone, or on Zoom, we'll ask you these questions during the interview. If you're participating in an interview through an online or mail-in survey, we'll ask you these questions in a follow-up survey that we'll send to you after we read your responses. The interview will take approximately 60 minutes, or maybe longer or shorter depending on how much you would like to share. For the online or mail-in survey, the initial survey will take approximately 30 minutes, and if we have follow-up questions, it may take another approximately 30 minutes. In-person, phone, and Zoom interviews will be audio recorded so that we can make sure we're using your own words when analyzing the findings of this study. We will not video record you. What are the risks and discomforts of the study? We're going to be asking you about your healthcare experiences, and we understand that most of the healthcare system is not set up to be responsive to the health of autistic people. There is a risk of discomfort when sharing experiences that may have been unpleasant, for example, ineffective, demeaning, non-affirming, uninformed, or dismissive. You do not have to answer any question you do not want to answer. You can stop or quit at any time. If you do become uncomfortable during the interview, you can stop the interview, or the interviewer may ask your permission to stop the interview at any time if they become concerned about your well-being. There's also a risk that personal information may be accidentally shared. The study team will follow professional guidelines to try to keep this from happening. If you become uncomfortable, this is a list of organizations that serve autistic people that might be helpful to you. We've included web links for All Brains Belong Vermont, the Autistic Self-Advocacy Network, Green Mountain Self-Advocates, and Twainbow. What are the benefits of participating in this study? There is no direct benefit to you from participating in this study, but we do hope to learn information to help autistic adults with multiple diagnoses in the future. Are there any costs? There are no costs for participating in this study. What is the compensation? As compensation for your time, at the end of your interview, you will receive a $45 gift card. You may choose a gift card to Target, Walmart, Amazon.com, or Giftagram.com. This gift card will be sent within 14 days after you have finished the interview, including answering any follow-up questions if you choose to complete your interview through a survey. You will be required to provide your name and address to receive compensation. You will also be requested to provide your Social Security number if the amount of the payment is $100 or if the total payments from UVM are equal to or greater than $600 in a calendar year. If you are not a U.S. citizen or permanent resident alien, you will be required to complete additional paperwork, including your immigration status, for payment. This information will be strictly confidential and will be used for tax withholding and reporting purposes only, and will allow the University of Vermont to determine your U.S. residency for federal income tax purposes. What about confidentiality? To protect your confidentiality, we will take extra precautions with data that could be used to identify you. Each participant in this study will be given a participant ID, which will be a code using a mixture of letters and numbers so that your name is not linked to your data. This participant ID will be used to label any audio recordings, survey data, and interview transcripts. During this study, we will keep a list to match your name with the code we have created to identify you. This list will be seen only by the lead investigator and study coordinator and will be password protected. At the end of the study, this list will be destroyed. Responses to the communication preferences questions, copies of the health questionnaire, and transcripts of interviews with all personal information deleted will each be labeled with the participant ID. All information that you share with us electronically will be kept on a password-protected computer. Any printed materials will be kept in a locked file cabinet in an office that is locked. For interviews conducted in person, on the phone, or on Zoom, the following slides apply. Interviews that are in person, on the phone, or on Zoom will be audio recorded. These recordings will be destroyed after 6 months. The only people who will have access to the recorded interview will be the study team member who interviewed you, the lead investigator, and a hired transcriber who will be responsible for typing up the interview. The transcriber will sign a confidentiality agreement before listening to any recordings. If you share any information that could be used to identify you, these details will not be included in the written transcript of the interview. The following slides apply for interviews conducted through online surveys. We will only use a UVM email account to contact you. You'll be sent a link to a survey on Qualtrics, a secure online platform for completing surveys with our initial questions. After we read your answers, we may email you a link to a new survey on Qualtrics with follow-up questions that are unique to you. We may continue to send you new links with additional follow-up questions until we're sure that we understand the story you have shared with us. All of your responses will be copied and pasted into a document and labeled with your participant ID. All original emails will be destroyed at that time. The following slides apply for interviews conducted through mail-in surveys. We will mail you a paper version of all questions and a return envelope to send your reply back to us. This paper survey will be labeled with your participant ID. You'll be asked to answer questions without sharing any information that could be used to identify you. After reading your responses, we may send you other surveys with follow-up questions that are unique to you. We may continue to send you new surveys with additional follow-up questions until we're sure that we understand the story that you have shared with us. All of your responses will be typed and labeled with your participant ID. All paper copies will be destroyed at that time. The next slides apply for all interviews. The results of this study may be published or presented. Your name and any personal information that could be traced to you will not be included. The organization that provided funding for this study and/or the organization that oversees research at the University of Vermont, the Institutional Review Board, or IRB, may need to access your research records to help verify research procedures or data. Any communications through email and social media are not considered private or secure. Though we are being careful to protect your privacy, you should know that information sent electronically could be read by someone else. We'll ask you not to share any personal information with us through email or social media. If your email address contains any identifying information, such as your name or birthday, the study team can help you set up an email address without any identifying information to use throughout the study. We will keep your study data as confidential as possible, with the exception of certain information that we must report for legal or ethical reasons, such as child abuse, elder abuse, or intent to harm yourself or others. The information we collect may be used for future research. We'll make sure that any information that we save beyond the study does not include any information that someone could use to identify you. Can you withdraw or be withdrawn from this study? You can always change your mind and stop participating in this study at any time. Your decision not to participate will not affect your clinical care, job standing, class standing, grades, or status on an athletic team. If you decide to leave the study, any data that's already been collected may be kept so that the researchers can give a complete report of who participated and inform future research unless you ask us to delete it. We may ask your permission to withdraw you from the study if the interviewer becomes concerned about your level of discomfort during the interview. If you wish to discuss your decision to leave the study at any time, please contact me using the information at the end of this video. Contact information. For more information about this study, you can contact me, Laura Lewis, by email at laura.lewis@med.uvm.edu or by phone at 802-656-3601. For information about your rights as a research participant or what you should do if you believe that you have been harmed due to being a participant in this study, you can contact the Director of the Research Protections Office at the University of Vermont by phone at 802-656-5040. Thanks so much for watching. Please don't hesitate to reach out if you have any questions that our study team can help answer.